Hi, Youth already. Happy New Year's.
Hi, Edwin. Happy New Year's.
Oh, Barry, how you doing?
I'm good. I'm good.
How's everything? How's your New Year's?
It was good. It was very, very quiet. I had made plans with some friends, but we kind of just stayed in, and didn't go out given the Omicron situation.
Yes, you haven't tested positive?
I have not,
Keep it up.
nor
I
have I
did.
experienced any symptoms.
I tested positive, man, and it's definitely not something, you want to get if you can.
Right. No, I mean, it feels like everyone I know has tested positive.
Gosh.
And I was alerted, 4 or 5 times in the middle of December that I had been exposed at various events, but I kept testing negative.
That's, beautiful. You're doing a great job. You're like the Matrix right now when they were throwing the bullets. That's like you right there. We just had a community member. I mean, she's not in the community board, but she passed away, 32 years old, from COVID. No medical history, no issues. She was from 153rd.
Was she vaccinated?
I'm not sure. That's a good question. But COVID is still killing people.
Yeah, it's interesting. That hasn't shown up in the data that I've been watching for our zip codes.
Yeah. It's a little milder. Now we have more ammunition. People are vaccinated, so we expect that it's not going to be as potent as the alpha, beta, delta, and now Omicron. But we have to see. Thankfully, people have protection, but with the way things are going, I hope we don't have the New York variant.
Hi, everybody.
Hi, Laquita. Hi, everyone.
Happy New Year.
Happy New Year's.
Okay, keep the conversation going. It's interesting. Is that Barry I heard? Let's see, Barry, Edwin.
Yeah, Barry, he's like, what was the name of the character in the Matrix? Cleo?
Neo, I think.
Neo, yeah. Barry's like Neo, dodging COVID.
Yes.
They got it, but Barry.
Oh, great, Barry.
Yeah.
But you were away, and everybody you were with got COVID?
No one, knock wood, that I've been with has had COVID. It was in New York, in the middle of December. I got a bunch of alerts that I'd been exposed in various events.
But it didn't come full blast on you.
Not yet.
Well, hopefully not. Even if you can't, you've been vaccinated. Have you gotten your boost?
I got my boost relatively early in late October, and I think it does fade.
Me too. When it first became available, even before others, before they said I could, because of my mother, I was able to get it early. Let's see, let me go to, okay. I thought Victor was going to be on too.
Victor, usually he joins.
Okay. Now, can you see me? I figured this time I would have it. I don't have my laptop.
I'll put my camera on so I don't make you feel alone.
Okay. Okay.
You get 5 extra points if you put your camera.
Okay. So what are we going to do today, Edward? Are you going to chair, or we'll just co-chair, or what?
So we have the agenda here. Is Miriam still in?
I believe she is, but it's still early.
Hi, everyone.
It's early. Yeah, it's very early. Hi, Jenny.
Hi. Is that
Hi, Happy New Year. I just got home.
Happy New Year's.
Happy New Year.
Oh, no, that's Jenny. No, who's Ibria?
That's Jenny.
I'm Jenny.
That's Jenny. Somebody with Ibria Foundation.
Yes, hello.
Hi.
Hi.
Okay.
Nice to see you all. Yes, I'm Isabel from My Brea Foundation.
Okay, Isabel, hi.
Hi.
So we have, let's see, Jenny, Laquita, Edwin. One more, we'll have a quorum, but it's only 6:22. Let's see. How's everything going, Edwin?
So far, so
With
good.
your-
You know, the hospitals in the city, some of them,
No, I'm
Yeah.
talking about with your
it's good.
your
It's,
special, yeah.
it's,
Okay.
it's moving along. One chapter away from finishing.
Wow. And then you defend, well, you polish it up and then you defend it.
That's correct.
Ah,
That's where we are. So
that's exciting.
keep me in your prayers.
I will. I will. So Barry is undercover. He has the logo, the borough logo.
Yes, when my computer is getting a bit old, but
Mine too. I couldn't, it is so slow. So I've been looking just within the last 2 weeks, I've been closing in on a computer, a laptop that I want. I want the Surface Pro. And I'm hoping to get that.
Well, there's always
What-
a sale. That's a good thing about America. You know,
What
now,
is that?
now we have what is it? Valentine's Day coming. They'll have a Valentine's Day sale coming.
Yeah, I'm gonna need it before then, I'm sure.
I love how they bump the price and they're like 50% off. And I'm like, but wait, it's the same price.
Yeah, that's what I'm wondering. I'm not getting the most expensive one. It's but it should have a lot of memory. You know, more
the-
gigabytes.
the common wisdom is that the best time to buy a laptop is in the spring because they do the sales for college students.
Ah, so I gotta wait till, well,
Like March is the March through May is kind of the best time to buy a laptop, is what I've heard.
wow. And that's when they bring new ones out so they can have a sale on the last model.
Yeah.
Oh, wow. Okay, see. Let's see if this will work. But after I turned my computer on and off, it did come on, but it's running very slow. At first it, wouldn't come on. Let's see, how do I get to?
So are we having the new Manhattan Borough President coming to our meeting?
Oh, at the general board meeting?
Yeah, very local, right?
Yeah.
I heard that Sean got COVID.
Get out of here, our city council member.
Yeah. Spreading like wildfire.
That he must have the Omicron, or was it announced?
That is the most prevalent in New York City. Good thing we don't
But
do.
the Delta, how is is the Delta more worrisome in New York City, even though the Omicron is more contagious?
So Omicron is the most prevalent one, meaning that it's the one that is hanging around the most. So it
But
basically, 95% of the cases that you have in New York City, they are Omicron. Omicron is an overachiever. Within a couple of days, it just took over Delta. But in the rest of the country, they have Delta. So when you look at the middle section of the country, about 75% of the cases there, they're Delta still.
Wow.
If you look
But
at,
Omicron is surging in Florida also, right?
yeah, so if you look at, it's like a wildfire, just like it happened before. It started in New York City, then it spread throughout the whole country. It makes sense because here we have all these global airports, not just international, but global. You know, we have connections to all over the world. The same
Right.
thing with Florida, the same thing with California. So these are the
Chicago.
Chicago. So, but these are the states that tend to sort of, you know, bring it up to the rest of the country.
Yeah, I knew air travel had a lot to do with it getting here so quickly. And once it was here, it just knew what to do. Let's see.
But by the time you find out, it's already here.
Yeah. Oh, wait a minute. I was on silent. Hi, Miriam.
Hi, Laquita. Happy New Year.
Happy New Year to you too. And Victor's on. Hi, Victor.
Hi, Happy New Year, everybody. Good to see everybody.
Happy New Year, Victor.
Happy New Year.
Edwin, good to see you as well. Just had my PCR test on 145th, so I'll hold my breath for a few days.
Awesome.
Ah, I
The
had
city
one
is
a
moving
week.
quicker.
Yeah, they only had about 10 people in there today.
The contact tracing is pretty bad with them.
Okay, no,
They went
they
through my
will.
whole
We'll see how
quarantine.
quick the results come. But as far as the number of people at this place, it wasn't bad.
It's
Yeah.
where did you go? It's where you get one for a free one.
Yes, 145th and Broadway, 2 doors down from McDonald's on the west side of the street.
Oh, okay. Okay. Let's see, we have Department of Health is here. Hi, Pauline.
Old Radio Shack.
Oh, okay.
Old Radio Shack.
Oh,
right.
yeah. Okay.
I think we have enough to start the meeting.
Right. So do you want me to start or Edwin?
You can start.
Okay.
Quita.
Well, obviously everyone can hear me. My name is Laquita Henry, as you may see. And as we've been saying Happy New Year to each other, I want to extend a Happy New Year again. And hoping all of us will have a very healthy one for our families and friends, and certainly for our community board. I am serving for a while as chair of the Health and Environment Committee. And though I've been chair in the past of a committee, I have to learn the ropes again and get caught up, but I hope to do that in fast order. So I'm glad that both Edwin and Miriam are here. Edwin is on leave, but we welcome his presence here and wishing him well as he pursues his doctorate and the dissertation. I don't think that's a secret. And then Miriam for all of her hard work in really holding the committee together and leading us. And hopefully, as you are here, you'll chime in and help, where you can. So I want to especially thank both of them. So let's get started. The call to order, it's 6:32 p.m. And can we, does everyone have, you see the agenda on the screen? Can we adopt the agenda? Can I get a motion to adopt the agenda?
Motion to adopt. Miriam.
Okay, and Miriam has moved to adopt. Do I have a second?
Second, Monica Dula, Happy New Year.
Hi, Monica. Okay,
New
second,
Year,
Monica.
Thank you.
Is it possible I can have someone take notes during the meeting? I'm gonna need that assistance.
Laquita, there's a record button on.
Recording,
Oh, it
Yeah.
is recording.
so you can go back and, take your minutes from there.
Okay, okay, so we'll have to do that. Meanwhile, thanks,
Laquita,
Monica and Victor.
I'll help you. I'll help you out. I'll write whatever I have, I can get, and then you can
Okay.
just polish it, okay?
Okay, terrific. I appreciate that. Okay, so have you had a chance to review the minutes, committee?
Yes.
Can we have a motion on the minutes to approve or approve with condition? Anyone? Any member?
Move to adopt the minutes.
Okay, and is there a second? Was there a second?
I second
good.
Miriam.
Okay, so it's been properly moved and seconded. All those in favor? Say aye.
Aye.
Okay, so I think there are 4 committee, let's see, Miriam's here, Edwin's here, Victor, Monica.
I'm not-
Jenny's here, I think.
Yes, I'm here.
Yeah, I'm not a
Okay,
committee member though. Heather's here. Solomon.
Who- Oh,
Here.
okay, that was Solomon, whose picture I just saw. Okay, so how many
Miriam.
members do we have? We have a quorum, so if there is something to vote on, we have a quorum for it, I guess. So did I count 5 committee members present?
1, 2, 3, 4, 5, 6,
I-
7.
Oh,
Yeah, you have enough to vote.
Oh, we
if
have
you to.
7 present. Okay, terrific. So we'll start the meeting with, we have 2 presentations, as you can see from the agenda that has been adopted. And we'll start with Department of Health. Ms. Pauline Ferrante is one of the representatives, and Dr. Michael McRae. And when you speak, you'll each indicate your role with Department of Health. And they've been invited to discuss the city's overdose prevention centers. And we as a committee and the board in a broad sense, have been concerned about information we have or don't have in terms of how communities are selected for various prevention centers that come into the neighborhoods. And of course, Harlem, in particular, our district, has had some comments from a number of comments from the communities that they feel that our communities are swamped. And so you can help us understand whether that's perceived or actual. So let's start with the presenters, Ms. Ferrante and Dr. McRae.
Hi, thank you so much. This is Pauline Ferranti. I am the Manhattan liaison for our community affairs team over at the health department. I'm actually going to turn it over to Chelsea Cipriano, who is the executive director of our IGA team. She will be assisting Dr. McRae tonight with regards to the presentation, but I am the liaison to Community Board 9 and will continue to work closely with you all on any concerns that pertain to the health department. So if Chelsea is able to share her screen, she will be able to pull up the presentation that Dr. McRae will now present on. Thank you.
Thank you. And if you need to share, then just indicate that, and that Victor's here to to assist us with all of that.
I appreciate that. I think, hi everyone, I'm Chelsea Cipriano, as Pauline said. I think I can do this. I'm gonna share the PowerPoint as a PDF, so it may look a little bit wonky, but as I, overcome my own technical difficulties, I will pass it to Dr. McRae, who is our acting executive deputy commissioner for mental hygiene and a wonderful resource for all of you for information about OPCs and other issues with mental health. So Dr. McRae, kick it off and I will get this up on the screen.
So thank you, Chelsea. So as Chelsea mentioned, my name is Dr. Michael McRae. I am the acting executive deputy commissioner for mental hygiene at the Department of Health and Mental Hygiene. And I wanted to come to give a brief overview of the overdose prevention centers. And then, but also I think just to back up from that, even in the, I want to have a very fruitful and thoughtful conversation with folks here. I want to really lean into what was discussed by Ms. Henry in that way, and want to know that we definitely are we hear what folks are saying around the overconcentration of services. And I really want to lean into the idea, the fact that these are providers who had already been in these neighborhoods and had connections to these spaces, and we're very intentional about doing that, in the selection of these sites. I think, for example, the place in East Harlem, has been there for 22 years, and so they're already part of that neighborhood, and they also. I think it's also important to stress that there are services that happen in those centers, but also they have an active outreach team that also is in the neighborhood and knows the community as well. So I think just some of the reframe there, but I think this is a good for conversation in general, but I definitely wanted to flag that just as something as we go through the presentation. And I'm sure we can return to that because I think there are very valid concerns.
Can this presentation be shared with us?
Sure, I think, we could share this presentation, yes. Okay, so there's been conversation for, many years, for over 20 years around opioid overdose epidemic. You see this graph right here. Last year was the highest in the last 20 years recorded in overdose deaths. It's a staggering number. So the time is now. That's why this is such an important topic and issue to address at the moment. If we look at our provisional data from early the first quarter of 2021, we're on track to actually surpass even this in 2021. So again, just really stressing the idea that this the time for this is now in terms of really thinking and addressing this, because every life is worth saving. If we look at this is a map of the city. Folks may have seen this map in other permutations. This particular one looks at the rates of overdose that are highest across the city. The darker spaces represent the areas where there's higher overdose rates, relative to the less shaded ones. As you see here, we see Hunts Point, places in the Bronx, East Harlem, Washington Heights, parts of Staten Island. There are lots of places in here that just there are systemic problems across all the entire city, to be honest with you. But if you look at this this chart or this graph here and compare it to looking at racial divides and other health outcomes, you see it's kind of a striking kind of similar pattern. The darker areas tend to be blacker and browner areas with the worst health outcomes. Next slide. So this is the kind of front page from the New York Times article that ran on the day that the sites were open. One thing I want to kind of highlight here is that they're calling these drug injection sites. And I think it's important to kind of really do a reframe in how we think about these sites. They're overdose prevention centers, and we're calling them that on purpose because they're doing offer many more services than supervised injection. Both sites offer access to mental health, substance use care, long-term treatment, all different kinds of services, wraparound services, in addition to this kind of the supervision of consumption. So it's important to kind of think about they're saving lives already. The first 3 weeks, they averted 59 overdoses. So we know already that they're saving lives, and they're doing an overdose prevention center kind of framework as opposed to just a site that has some kind of supervised injection program. So we know that the OPCs are evidence-based strategies. What they're offering in those spaces are hygienic and professionally supervised facilities where people can use drugs, education, equipment, and there's oversight of all the practices of drug consumption that are in those spaces. And then in the end, again, we are connecting people to health and social services, including drug treatment. The picture down here is not the one from either one from the cities, one from Vancouver, one of the first OPCs. And as you can see, it's different than what people kind of expect. Some people expect, like, what is it going to be? Like a bunch of people just kind of laying around. Like, no, it's very hygienic, well supervised, well lit. You'll see that there's a. Oh, let's go to the next slide. I think we do have a actual one of the one in East Harlem here. Just kind of paying some attention to kind of some of the structural things. If you look forward, you'll see kind of a mirror. And this allows the participant to both see who's behind them, but the person who's behind them to be able to supervise, kind of what is happening with the person. Are they dozing off? Can we intervene at this moment? Right? This is the same person who may be on the train, the subway, with no one supervising them and much higher risk for overdose. So we know that OPCs reduce overdose deaths in neighborhoods. There's 30 years of research on this for over 100 different centers across the world. We know that they reduce overdose deaths in the neighborhoods. We know that we see decreases in drug injections and syringe litter across neighborhoods. We see a reduction in drug-related crimes, and there's no increase in serious crime. I think some of the part of it is kind of debunking myths, just from what we know from the research. And we know these are serving participants who are really not in contact with other essential health services. So these are people who are having difficulty accessing those services. And we know that we're increasing people's use of primary healthcare and drug treatment. One thing I will say, just in having worked so closely with the providers, what we know also is that people, and also the research will show that people don't travel very, very far from the neighborhood that they're using in to go to these centers. So it's very unlikely that someone, from Brooklyn is going to be coming all the way to East Harlem or to Washington Heights to use an opioid prevention center. They're going to be in a space that they're in already, and we're finding this is true. These are some of the same people that were already using services who are maybe now using this other service as well on top of other services that they were using already. So these are folks who are already in those spaces, and we're just trying to provide a way to, save lives and for those individuals. Next slide. So I kind of get ahead of myself in some of the earlier kind of pieces, but there's over 60 jurisdictions worldwide, over 100 OPCs across the world. Like I said, 30 years of evidence shows this, and there is growing support across the United States in some of these in this work in this way, different kind of models, and so we are really happy to be thinking about this with our partners across the country, from Philly, Seattle, and all the places that are down there. San Francisco, we've got, you know, lots of different municipalities are coming to us and asking, how can we do this? We want to do this in the right way. And we understand that engagement of community is paramount in that process. So we know that OPCs will save lives and improve health in New York City altogether. Below here is a quotation from someone who uses, from a person who uses drugs. I think it captures something that's really important that I want to kind of highlight after I finish talking about it, after I mention it. Having a place to go where there's others around me, it could be uplifting and not only save my life if I were to overdose, but save my life in other ways. And I think to me, this underscores the humanity of the work and how these providers are providing folks with life and options and acceptance and a place to go, and really treating them with the utmost humanity. From showers, you know, basic needs are being met there, and it's really quite a marvel, something to marvel at. I think you know, there's you know, I think oftentimes, you know, my own personal story, we all have experiences with people in our own families, you know, who use drugs. I know I do. And you know, from years, my father himself was someone who died of AIDS and was a heroin user. And I think about these kind of spaces, and I think this could have been someone who he could have saved his life. And so this to me kind of hits home. But I think we all have experiences of people who we know who use drugs and really need that extra kind of contact with a humane service that really helps offer them connection to care in a humane way. So I think with that, I'm going to stop there. And I love to take questions. And so let's, I don't know how to.
I have a question.
Okay. Is that Miriam or Monica? Okay, go ahead, Monica.
What is the overdose rate in community board number 9? And where does that put us in the city? And second, the facility on in East Harlem, do they go out and do like outreach to actually get junkies off the street to prevent them from overdosing?
So, okay, so two parts to that question. I'll start with the last one. People who use drugs, yes, they do have they have outreach teams that know the neighborhoods, that know the folks in the neighborhoods. They are constantly in the neighborhoods trying to bring people in, referring them to different services. The city also has joint outreach, operations. So there are DHS folks who are out there in those spaces. You know, Health and Hospitals has a mobile van that's out there. You know, and also there's also the addition of having NYPD, making sure that kind of there's a, you know, that they're not kind of quality of life issues that are kind of actualizing in that space.
Okay, so that means that, so the precinct has a car posted there or somewhere near there?
Not posted, there is a recognition that we want to make sure that that things are like not out of control, which they have not been, right? We're
Right.
part
No. I understand. I'm a criminal defense attorney with legal aid, so I totally endorse what you do, and I understand why it's important. I've had 6 clients overdose in the last year, so I understand.
Yeah.
And can you tell us what the stats are? I'm sorry, can you just tell us what the stats are in community board number 9 so maybe people understand a little bit better?
I don't have the exact numbers for community board number 9 on me. I don't know that we have that broken down in that thing. Chelsea, do you have the on that?
Yeah, no, that's a great point, Dr. McCray. We don't have the numbers broken down by like a community board or political district or other types of districts. We do have it by zip code and by neighborhood. I put up a link in the chat so that y'all can look at the data that we're looking at.
Okay, thank you.
You're welcome.
I mean, I will also say, I think if you look at the chart, at the graph that was put up, there are areas that are dark, blue, areas that are lighter blue, but it's still a problem across the entire city, right? And so we went with providers who were ready to do this at that moment, have relationships with the community, they and longstanding relationships, and they were ready to actually able to implement it. So we're being thoughtful about even why would who we would want to kind of choose to be to partner with us and kind of implementing additional ones. But we do believe this should be something that's across the city in many different areas, across many different areas.
Okay, I don't see the stats. And somebody asked you about bathrooms. All facilities have bathrooms. Yes, there are bathrooms in these facilities. Can you just explain that, please?
Yes, there are bathrooms in the facilities. There are often they offer shower services as well. When they have there are stocks, kind of basic clothes, basic needs that are met there, snacks, all kinds of kind of services that are offered there that are just basic kind of human needs.
There are some comments in the chat and questions that I've gone to the chat to pull up after the restroom facilities question. There was a statement that zip codes 10027 and 10031 are the largest zip codes in CB9. But what percentage of clients seen at the OPC are actual residents of the borough and a borough of Manhattan versus traveling to Manhattan or transient to NYC for the services? And let me see if I can get the other one out before I lose it. There was a question, what about addicts who store drugs? So those are two separate questions, but they came up in the chat, so I wanted to make sure.
So let me start at the top, and I'll kind of go down as well. Thank you for the questions. So they are interested. They are working with folks who are using all kinds of drugs. It's not just supervising. It's not just heroin through intravenous use. Individuals can go there and use drugs in the safest way possible with supervision. The question, or we answered the question around
traveling to New York and go traveling to Manhattan versus.
So what we know from the research and anecdotally from the providers is that these are people that are already receiving service, that were already receiving other services that were there. Again, the opioid prevention center services are additional, or those are the injection site services that everyone's kind of talking about. That's in addition to services that they were already providing. So what we're hearing in terms of reports are these are very much the same people, and people are not traveling outside of their neighborhood or where they normally go to get to get high. It's very different than like someone would go to a different neighborhood to get for their primary care provider.
Victor has let me call him Victor, as a question.
Yes, I do. Thank you, Dr. McCray, for your presentation this evening. I appreciate it. I had a few points that I wanted to make as far as people traveling outside the neighborhood, coming from outside the neighborhood. When you showed the map, I saw on the map Port Richmond, Stapleton, and another area in Staten Island. I was actually the director for public housing in Staten Island for 4 years. So I'm very familiar with that. And I know for a fact, a lot of those people traveled to the city to get those services. So there are people traveling, especially in East Harlem, from outside the community into that particular community, and probably here as well. So that was one of the concerns that people had. I know you're saying anecdotally that that's not the case. They're serving the people they've been serving, but those people that have been serving have often come from outside the neighborhood. So that's a concern. The other concern is Base Piggyback was a place here, 145th between Broadway and Amsterdam, that I worked at a drug treatment center years ago. I think it's taken over by August Group now. an issue we had there when I did volunteer work was what I called drug dealers preying on clients. They go in, they get counseling, they get treatment. 3 or 4 blocks away on 143rd, 142nd, you had drug dealers that would prey on them, knowing that those people came to that area. So just concerned the same thing might happen. What, if any, is being done to address drug dealing in the area? Because these centers are not providing drugs, correct?
Correct.
They're just providing a space for them to safely inject themselves. So they still have to get drugs from somewhere. We're concerned, where's that somewhere? And that somewhere often is close to the center itself, which brings a whole different element to what's going on. I don't know if they're going to have patrols that kind of make sure that that's not happening, but that's just a concern of mine. And thank you for your time.
So no, I think I appreciate your questions, and I think going from the last one that you mentioned, you talked about, there is a like I said before, there joint police, NYPD are partners in this and are monitoring the situation, as are the outreach teams that are in the areas. And what they have seen is that they're not seeing an increase. I will say that people are going to buy drugs anyway. And they have been buying drugs from those same people. As you know, in many of the areas, there are when there are drugs around territories and blocks. So these are people who are kind of purchasing drugs already, and we're not providing them with any drugs at all, and actually monitoring the use while they're there. So. So I think I just wanted to kind of, I think there is special attention being paid to kind of what is going on in the ground and in the neighborhood.
Right. One of the complaints I heard that one of the sites was near a school, and I don't know if that's true. I don't know the exact address, but that would be a concern of mine as a parent, that you had, this going on. They injected themselves safely, they're fine, but there's other activities that that go on with drug users that are not appropriate to children in the neighborhood or anyone in the neighborhood for that matter. So that was a concern in placement, even though some of the places might be well suited now for drug prevention, but drug injection and people leaving there in that state is a different issue in my mind.
I will say that people are monitored kind of while they're in the center. As they're going in, while they're there, and after they leave kind of that, that area. Again, we had the concern and kind of discussion around, oh yes, it's across the street from this, the center with children. Again, the center actually has a relationship with that school. They've been there for 22 years again. So there's always been their kind of, they kind of find that connection with the community members and community sites, and is like essential to, it's working out well. Which is why we want to really be intentional around making sure that we are working with not only like, we want to go, we would like to spread this across the city, but we also want to go with providers that are ready, capable, and able to do this, and are working, towards good relationship with communities.
Thank you.
You mentioned, I'm sorry, Victor, you finished?
No,
okay.
yeah, I'm finished.
You mentioned relationship with schools. What about with the precincts, the area precincts? What is the relationship generally from a community standpoint or administrative standpoint?
So we think that it's very important to kind of have all the agencies kind of on board when these kind of, as we kind of think about and want to expand this across the city. So at all steps, yes, the precincts are involved in the process, because they're the ones who have to know kind of what's going on, in that area. So they're definitely part of that kind of joint operations part of this work.
Jenny had a comment, but Jenny, I'm not sure in the chat. Can you restate where your comment was about East Harlem being in the middle? What can you expand on that?
I think she left.
I think Jenny has to leave, but what she said was Hunts Point is higher, and Katona, Tremont, East Harlem was less in the middle than White Harlem. Again, we were going with individuals who were ready to kind of able to do this in a way that we thought was going to do fidelity and goodness to the model.
I would like to piggyback on what Victor said. I understand that these are folks who are already seeking the care of, these centers, but that is because you have a desert in other communities. That is kind of like saying, well, folks, they go to Sloan Kettering, so therefore, in other areas you don't need it, right? Well, they go there because this is the cancer center in New York City. You have many others, but HHS, hospitals of special surgery, we know what it's for. So I think that the data, when we look at it, we should also look at, because it can be extracted from these medical records, where the zip codes are coming, because as you stated, folks, when they have to travel, they are less engaged. So they are probably coming to these centers because that's what they have. But to have a better impact is, the city should do an assessment as to where they come from, so we can bring those services to them.
Dr. McRae?
I mean, I think that all the data and even that the center has around who's been using it, the people who've been coming there for a long time, and I believe they're from that neighborhood, but I don't know exactly. I can get more granular information around kind of how the data is being collected. I can get back on that. But I mean, everything we've heard, and then what we know from the years of research is that people don't do that much travel. There may be certain situations here and there, and I think we address those on a.
So it's a different story if I'm in Delaware County, because Delaware County, you have to travel. So there, the expense of even getting grocery is very different than in New York City. In New York City, if I have to travel from the South Bronx or from Staten Island, I'm going to pay the $275. So I think that when we look at data, we have to make sure that this information that you get, and please send us the references because we will look at it. I think that we have to make sure that these are city comparable to what we look like. Because just to say, well, when we look at the data, we're comparing apples to apples.
Dr. McRae, since there's a lot of concern about that, maybe that's something you can discuss, at the center and find some answers or presentation that could, hone into those zip code concerns, or where the users are coming from.
We'll certainly.
Question.
We will definitely circle back.
I have a question.
Okay. There was I'm sorry.
Miriam was next, and then Barry.
There was something Heather raised, an interesting point that I wanted to get to. I'm sorry. Then we could come back then with Victor and Monica. Heather, you raised a good point about are those users required to enroll in all of the services, I think, to guarantee that they're going to be fully helped.
No, people go in there, and it's a menu of services. They're able to use the services that they would like.
They're not required to sign up for all of
They are not required to sign up for the service. It's kind of one of the tenets of harm reduction in this way is, you kind of build the trust over time. So folks will come, it may not be their first time coming in, their fourth time or their 10th time, and maybe their 11th time they come in, that they say, hey, this guy over here is, he's been solid. He's been, giving me this stuff, taking care of me, give me food, like maybe, let me listen to him a little bit more. And that's kind of how the relationship is built. And then eventually that leads to like a more connection to long-term services.
Heather, does that answer or get to the gist of what you were asking or making a statement about? I'm not sure if she's on mute. Okay, well, let's go on. Victor.
Miriam was next, and then Barry. And then Monica.
Oh, okay.
Miriam?
So our order is Miriam, Barry.
Monica.
Okay.
Thank you.
Miriam.
Thank you so much for this presentation and for just taking our questions. I know this is not an easy conversation with the community. As much as we know we need this, it's not easy to figure this out. My question is, and you started out with every life is worth saving. Addiction happens when people have no purpose. We are treating addiction by enabling it. versus healing the human being who is broken. And I hear you that there's these wraparound services, but they're always in addition to the enablement of continuing to be a broken person. And I think the shift needs to be, it's starting at the broken person. And I'm very confused with how we are in a democracy enabling a Schedule I drug when we arrested and destroyed the lives of hundreds of thousands of people over marijuana. And here we are in the same city, letting people walk around with heroin, with fentanyl, with cocaine, which are real hardcore Schedule I drugs, which have no benefit to humanity. How are we saying this is helping society, helping every life, helping our community, helping our children? What are we saying to children when we do this? Because I'm confused as hell right now, how a Schedule I drug like heroin is okay to go shoot up somewhere when there's people walking around this community, and why we're prioritizing this. I get it. You know, America has a drug problem. America, not Harlem. And I hear you, we have addiction here, because walk around the community, it is everywhere. But enabling it is not going to help people. I don't think we've done the work of really figuring out what helps people. Oh, Vancouver, Canada did this. I used to go to Canada every week for work. It's a socialist country. It's super clean. People are super controlled, disciplined. It's a whole other universe. It's not Harlem. It's not Washington Heights. It's not New York City. So to model Vancouver, the success of Vancouver, Canada, in New York City, where we have a track record of a failed attempt at treating addiction in East Harlem with drugs, I just don't think we're trying enough to really save human lives here and to really push the envelope of critical thinking of how the hell to dig ourselves out of America's addiction problem. Because it kind of goes down to opportunities. When people have no purpose and they don't have support, this is what happens. So we can get people to shoot, get them to shoot up, but then they leave the space and they have no purpose, they have no life, they have no support. What are we doing to help people? Because we're helping cartels right here. This is a symbiotic system we're creating. And that's all I have to say.
I mean, sure. I think, this question is well received. I know that this is a concern of many people. I will also say that this is harm reduction. And this we know leads to people not using drugs and getting connected to care services. I also do appreciate kind of your kind of thoughtfulness around like the whole person, right? The whole person, and I will say that, having been to the East Harlem Center, they have a component that focuses on yoga and exercise and meditation. So I think that this, again, people are complex and we need a number of different kinds of services at different levels. And I can appreciate kind of this, this is not the end all and be all. This is one component of a person's whole care. And so as I'm thinking about it that way, I know it's difficult to kind of wrap our brain around sometimes, like, oh, people were allowing people to use this, in this space. And we know that same person would be using that in the subway, leaning over and perhaps, overdosing and dying when we could have prevented that, a block away.
But if you're allowing them to stay addicted to this substance, when you're not around, they're going to go to the subway because that's what's happening right now. And we're very concerned that you've put our community's in the middle of it. And if you ride the MTA right now, if you ride the #1 train, the back of every car in every station is a shooting gallery. And this is reality. And our children have to walk through this. And when you continue this cycle of addiction, with a Schedule 1 drug. I'm going to keep going back to a Schedule 1 drug. Like, yes, we have to treat the people, but we've now switched up methadone to giving them the pure deal. I mean, I'm just having a lot of mixed, I hear you, I hear the human side of this, but I don't think we have figured it out, because we just went really extreme. We went from giving them methadone to, you know what, let's give you a really clean, safe space. And the drug dealers are just like loving this. And it, you know, the timing with cannabis legalization, did you all think about what this means to drug dealers? I mean, my God, like, you're just telling them switch up drugs.
Victor?
Oh, no, I'm the, Barry was the next speaker.
Oh, Barry, I'm sorry.
Yes.
I can't see the hands up.
Oh, okay, I'll call him out for you. Sorry.
I had a couple of questions. One is a concern, really, which is that, you know, I understand the maps indicated that these two sites were opened in areas with high rates, but historically, Upper Manhattan, due to racist real estate practices, has been cited for an overconcentration of facilities serving people with substance abuse addictions. Not because it's close or convenient for people with substance abuse addictions, but because real estate is inexpensive and other communities are more organized and politically powerful and can oppose citing these facilities in their communities. And so, you know, I think Staten Island has like 1 or 3 methadone clinics and Upper Manhattan has 30. And it's not because there are 10 times as many people with opioid addiction in Upper Manhattan. It's because Staten Island communities successfully oppose these sightings, and we wind up with an overconcentration of these sites where state OASAS data shows that 80% of the people who use those sites come from other areas, sometimes not even within New York City. And so I think one of my questions is this a pilot program? Are you looking at metrics or evaluating this for further expansion or refinement? And if so, you know, how will you be tracking that? And then the second question is, what steps will the Department of Health be taking to make sure that what we see with methadone clinics in terms of oversaturation in particular neighborhoods due to real estate and histories of racism does not occur with these OPCs?
Thank you for that question, for the question and concern. So I think, I mean, this I think requires an acknowledgement of the history of medical redlining, and I'm going to be very, you know, transparent about that. We know that is a structural thing that needs to be addressed. You know, as you know, the Department of Health is not responsible for the placement of methadone clinics. And we are doing things to think about how we can, there's lots of concern around like foot traffic, right, in those areas. So we're advocating for ways to get people more methadone so they can have to come out, you know, 6 days a week. You know, really thinking about giving people, you know, expanding access to buprenorphine. Those things.
Right. Well, I mean, not to interrupt, but buprenorphine-based treatment has also been redlined in that it is overwhelmingly given to whiter and higher income people compared to working class, low income people of color who are frequently routed to methadone treatment.
Which is why we're advocating for expansion of access. I think, you know, the thing that, again, I'm going to go back to, you know, these are not like new sites that we kind of put into, you know, new services and into a new building. These were offering services already, and we just added to their menu of options. So the body doesn't fully answer all your questions, but I do kind of acknowledge that there's like, we're being thoughtful about we don't want to oversaturate. You know, we're thinking, you know, we're only going with people who are already there at this time. And there are no plans to like imminently open up any other ones, but we do think this is a good strategy for across the city.
If there are no plans to open further ones,
At this time.
Is that because you're evaluating the initial outcomes from these first two sites?
I think absolutely. We're definitely looking at kind of what is the data telling us from from what we're seeing here. We've already released data on kind of the numbers of overdoses averted, the number of kind of center uses. We're also looking at we also would like to get other data to kind of figure out how effective we are being at reducing these problems.
And I guess one final follow-up question that I'm done is one of the metrics that is being tracked people who have accepted referrals to substance abuse treatment programs?
Yeah, so there's data that's being collected already by the providers that looks at kind of their connection to people with services. Yeah.
Okay, I thank you. I think our concern, which I think you hear, is just that if these sites are evaluated to produce the desired outcomes that the Department of Health has for them, we wouldn't want the next, the first two are in Upper Manhattan. We wouldn't want the next two to be in Upper Manhattan as well. We would want, if these are judged to be a positive tool in reducing, problems associated with substance abuse, including overdose and death, we would want them spread throughout the city, not just located in communities that have historically borne the brunt of treatment for drug addiction and substance abuse.
Noted. And we're also, again, we're focused on people who are also ready and thinking about like who is ready to do this work in a good way as well. So that also has a lot to do with kind of where future ones could be. But again, we want to engage community members on this throughout the process, right? Like that's the point why I'm here, right? Like so, we want to keep folks apprised of kind of like when we're what we're thinking with other providers. But we do want to do, we have to do an assessment of kind of readiness and what makes the most sense given the data and people's readiness to actually be able to roll this out.
Okay.
Thank you.
Monica Dula.
Thank you, Victor.
Mm-hmm.
Doctor, it's admirable what you're doing, and I hope you don't get discouraged by this conversation. Some of us in the community understand the addiction process a little bit better than others. But you said that there's no plan to open up any new ones. Are you looking at the data for 1 year period or a 6-month period to figure out if you're going to open up a new site?
I think we have years of data and looking at increases and where current need is right now for sure. Right. But like I said, there's no current plans to open up anything immediately. We are we are engaging providers and seeing who's kind of ready, kind of what makes the most sense, looking at all the data. But there are no decisions been made around like we're moving. And also these are already folks who are, current providers in neighborhoods. These are not city-run sites.
And let me ask you a question. Who's running the site in East Harlem?
On Point. They were formerly.
Okay, I know On Point. I know On Point.
Yeah, they're formerly New York harm reduction educators.
Yes.
Yes.
All right.
Okay, but let me just say, don't be discouraged because nobody wants it. They see the junkies, but nobody wants to deal with it. Just to let you know.
I'm not discouraged. I'm actually encouraged because I'm happy that folks are kind of posing these questions and getting it out there. So, and I'm happy to be here speaking with you guys. So I mean, these are conversations that I know are difficult. They're challenging for me because I want to kind of make everything right, and I want to be able to try to make sure I'm working with people in an honest and thoughtful way. And so sometimes they're challenging, but I enjoy it, and I'm here for it.
Thank you, Doctor. We appreciate it. Really do. Question from Isabel.
Yes, it's more like an offer. So I think most of you don't know me. I'm Isabel from Harlem Brain. We have a center here in Harlem on 131st and Adam Clayton. And we do holistic training. So mind-body training and also training with the brain to help change habits. So actually, this is a topic that's close to my heart as well, because I have family cases of drug abuse. And I wanted to suggest, I mean, we have a center here, we have a space here, but we also do outreach. We mostly work with kids in schools to help their mental health. But I'm thinking it could be very useful for this kind of case as well. So if you would be interested, would be happy to consider that, like either going to the centers and give sessions. I think what Miriam was saying is actually very important. How, you know, the situation that they're in is it has a deeper root, and it's really in the mind and in the whole human being. So we do work on that, and also helping them change habits. So definitely we wouldn't be able to give them specific opportunities after that or things like that, I can't promise, but definitely we can give them a good training opportunity. I heard Dr. McRae, you say that they do have yoga programs and meditation programs in some of the centers. I'd like to hear if those are working well, and just bring our contribution to the table. So thank you so much for your presentation and everybody's comments and questions. It's very valuable.
Thank you.
Thank you, Isabel. Anytime people can talk about wholeness and wellness, I'm for it. I'm happy to kind of visit the center and talk to you offline. I mean,
yeah, I'll leave my email in the chat box, and then maybe.
Thank you.
Sounds good.
That does.
I don't see any other hands up at the time.
Victor, I thought Edwin, I'm
sorry.
sorry. I saw the hand.
Edwin, very sorry. My apologies.
Okay.
Dr. McRae, thank you for doing this. We know it works. It works in other city. I think that in New York City, we're going to find our own recipe as to what works. And that's what happens in research, right? Every hospital, they have their own protocol. You can have Columbia, you can have Sinai. We all have the same protocol for sepsis, but sometimes you got to tweak it a little bit because it has to fit your institution. The same things happen here. And I think that when we look at the data, it's very objectively that we should look at it so we can learn from it. And then we can try to make those unique tweaking so we can better serve our community. And then we don't have certain community to feel like they have continue to be redlined, right? Because of the real estate, because of the location, geographics. So all the questions and comments and feedback that we got, we hope that the Department of Health goes and do some of this work and see it as constructive, because I think that's what's going to help make the sauce much more sweeter for us here.
Thank you, Edwin. I think that
you.
was a terrific wrap up. Were you adding something, Dr. McRae, in closing?
No, I appreciate your candor and your comments, and thank you.
This is Heather. I have a question, if you don't mind. Can you just walk us through the process of what happens when someone initially arrives at the facility?
Sure. So as I mentioned, this is one of the services that they offer. So someone will come in, they have a unique identifier number, and they can have access to all the services that are there, whether it be the regular syringe services, whether it's a shower or basic services, basic needs services, food. They may want to use this particular kind of the injection area. And they bring in what is considered one dose for themselves. They have to identify what the dose is, and they go into the area and they're supervised. If the person kind of notices them knocking out, they kind of do one level of intervention, and as it goes more progressively, they go with a kind of a fuller intervention.
So
they-
there is one person assigned to each person that comes into the facility, and the people are bringing in their own drugs for use in the facility?
People are using they're bringing in their own drug for use in the facility. There's not one person per person using. There's a number of rows, as you can see in the kind of picture, the number of rows. You have someone who's monitoring.
How many people are assigned to one provider, one person, or one caregiver?
I do not know the numbers on each caregiver, each person who's supervising.
So based on the models that have happened in previous centers, what you have is a team of providers. Not everyone is going to go into an overdose.
Right.
But those that do, you have a team that will respond to it. So that's typically how the model works. It's not like in the hospital where you have a ratio. If you are in the ICU, it's 1-to-1 sometimes, 1-to-2. If you're in the ER, it's unlimited. This is a very different type of intervention.
So you're saying that each person receives a number when they enter the facility?
Yeah, like a unique identifier for themselves, yes.
Okay, so you're not taking any names, it's totally anonymous?
Correct.
Okay, you're not taking any zip codes?
I believe I believe they do know kind of where the person is coming from, yes. I can get more information. I can't speak to the specifics because it's not a city running it. This is remember, they're a private provider.
Okay, thank you.
Thank you.
Well, this has been very, very interesting, important conversation. There's a lot more to know. And I'm hoping that you'll be able to come back and visit with us again and maybe address some of the other issues more specifically. I think it's been wonderful, and I appreciate on behalf of the committee your coming and making your presentation. Chelsea left information in the chat, general documents or online articles. So be sure to get those. Hopefully the committee will. And you'll provide the, Dr. McRae, the presentation, make it available to us at the outset. One of us asked about that you felt that you could make the presentation available with the data, the chart.
I think Chelsea, can you help? Chelsea.
Pauline or I will share this, and then thank you so much for calling attention to the links that I dropped in the chat. These are data reports that are updated fairly frequently, usually about quarterly. As Dr. McRae noted, some of the data is provisional, but particularly for the first quarter of 2021, unfortunately, it shows not very good trends as well. So keep an eye on our data, and we're always happy through Pauline to share more with y'all because we really appreciate these questions.
I will make one last comment. These vendors, I think it will be also nice if they can come to the community boards because they can get also a pulse of what's happening in the community. They do the outreach within the vicinities. I don't know what the radios look like, but here you have folks from different parts in the community that can provide them an insight into that blind spot that we all have.
Very good. Good point.
Idea. Yeah, good idea.
Thank you.
Okay. Thank you. Thank you, Edwin. And thank you again.
Thank you, Doctor. Appreciate
Department.
it very much.
Thank you. Thank you so
Yes.
much.
Thank you.
Can I throw out a quick question?
Yes, David.
Yeah, I don't want to take too much time at this point, but this has really been eye-opening for me, and I appreciate this whole conversation. I come from a family, of alcohol, people recovering from alcohol addiction. So and on that level, I kind of relate to some of the distress that just runs through all this. What I'm wondering is, what can the rest of us do? I mean, if anything at this point. I mean, Councilman Mark Levine has been the head of our health committee, I think, in City Hall up to this time. I mean, would the person in that capacity be someone to reach out to take some measures to maybe create or improve resources that are already available for folks in recovery or trying to recover?
Good question.
Just wondering what the rest of us can do. Thank you.
So I would a few different things. I think kind of on as a kind of regular, as a community member, we always have access to NYC Well, 888 NYC Well. So that's kind of, you can get anybody access to kind of, services through there, maybe in your network. If you see people kind of who are on the street who may have a kind of a substance use or concern or mental health concern, you can always call 311 and get that person access to services. I think from there, I think, we recently did a call to action with the Board of Health around this, really relaying the importance of this work. So that's coming. And then we are
And Dr. McCray, I just dropped that in the chat as well. Everyone can see the recent statement from the Board of Health. The Board of Health, for those who don't know, is an independent body of experts, of health experts, that advises the health department and kind of votes on actions that the city must or should take. And one of the things they just voted on was this call to action or statement about OPCs. And a couple of the things on the third page, if you scroll through all of the whereas, they call on the federal government and the state government and State Department of Health to really address some of the issues that you all have been talking about in terms of expanding access for harm reduction services and medications such as methadone and bupe. So those are some call to actions within this document from the Board of Health. So I think in terms of engagement around that, these are things that the board called on the city, the state, and the federal government to do. So feel free to use this statement and share it.
Thank you, Chelsea. Perfect.
Thank you again. Thank you again. Okay. Good timing. We are prepared now to move on to our second presentation. And I don't have the outline of the agenda right in front of me, but I know that it's the bridge, and they have two representatives here. I apologize for not having the agenda again, trying to be, I'm not as handy with manipulating the Zoom back to the email. So if you would start your presentation, introduce yourselves and in what capacity you're presenting to us. We welcome you. The bridge. Are you here? I think one person is here. I think Cheryl.
Yeah.
Are you? I can't see, Victor. Are they muted or?
Oh, who are we looking for? I'm sorry.
The bridge, representatives from the bridge. It's Cheryl is one participant.
I don't see it.
I don't see it.
No. So.
Oh, I wonder if they, or is it Susan?
No, you're right. It's Cheryl Silver.
Okay. I wonder if they left. I don't know if there's an indication that they had to leave earlier or not. So is there a representative here at all from the bridge? Okay.
They might have left because they were actually a center that dispenses. I believe they're one of the centers that is in East Harlem doing everything that we were discussing.
Okay, I know they have a terrific reputation. They've been in the city a long time, but if they didn't respond, they must have. But I don't remember seeing, trying to go back and forth. If one or other indicated they had to leave, but they were announced at the outset. So they requested to come, I believe. So hopefully we'll get some notification as to what happened. Now let me let me find the agenda, or does anyone, Victor, is there any way you can get the agenda back on the screen? Okay, I appreciate it. Okay, it's coming.
There you go.
Okay, thank you. So that was a very important and necessary discussion. So we'll see what can come out of that. But we'll move on to old business. I don't have any information on the Mount Sinai Ambulance Serenity Committee, I believe. They're the ones that have made presentations, and they did in December. I don't believe that youth has heard anything back from them. I'm not sure if anyone else has. But in our old business. Any comments on that? Miriam, you were working with them. Anything in particular?
They're
that was
actually,
supposed
I
to-
believe, they were coming to speak at this month's meeting because there's Susan and I believe Carol Shervin is
Oh,
here.
Susan, I saw Susan's name.
We're
So
here.
they are here to speak.
Okay,
I
so
just
Susan,
added them under old business because we had those two big presentations.
okay, no problem. And thank you for that information. So both Susan and Carol are here. I saw Susan's name. So if you could give us a follow-up, that would be terrific.
Well, I thought someone from Mount Sinai was going to be at this meeting. I don't know if that was in the works or not. But we did meet with them through Community Board 9 at least 2 years ago about the sirens, the
I
extremely
remember that. Mhm.
shrieking sirens. And basically nothing about the shriek has ended. There was some movement to get the ambulances to not so many to go past Morningside Gardens, I gather, but David Vassar, who was here earlier, he could speak to that, or maybe Carol can. But I live at 110th in Amsterdam. I've been here my whole adult life, which is a long time by now. And, there are 3 different fire departments and all the ambulances come through this intersection. And when Mount Sinai started buying up a lot of the hospitals, they got new trucks. And I've talked to some of the EMT drivers who said, yes, we know there's a problem with the sirens in the truck, but they can't fix it. And I can't believe it can't be fixed. So we did have that meeting. There are apparently 5 or 6 different variations of the siren within the truck. And so they tried the high-low version for a while, but it was equally loud. And I suppose it annoyed people just as much because they're not using it. There's exactly one truck that goes through my intersection every so often with a very low range. And I'm thinking, if that one can do it, why can't they all? If that's in that mix of 6 sirens, why can't they all do it? So, since they're not here to address this, I would just put it out to the community board that we really need to prevail upon them to change what they have, because it's just wrecking our lives and our eardrums, literally.
Have you had, there was some discussion about the fire department regulating the tones. Has there been a meeting or any correspondence with representatives from the fire department, New York City Fire Department?
We have not had that meeting. What I understand about that is that the fire department back after 9/11 regulated the decibels, and they regulate the decibels anyway, and they raised it under Giuliani's administration on his way out the door. But the thing is, the fire department ambulances are not as bad, and they don't keep them running all the time. And I asked one of the Mount Sinai EMT drivers about it. He said, oh, well, that's because if they get into a crash, the FDNY covers their insurance. If we get into a crash while we're going on a call and our sirens are not running, we are personally liable.
That
So
doesn't sound right, because if I'm in my
that's-
car, if
if I could finish, that's the big difference. The Mount Sinai drivers are personally liable if they are in a crash, while the FDNY drivers are not. That's a huge difference. And what can we do about that? I'm sorry, please go ahead.
Susan, I think we need to have Sinai, because it does, from a liability standpoint, it just doesn't make sense. If I lend my car to Victor and he gets into a car accident, I don't carry that insurance. The car has it. So I'm not, I just haven't heard of this before.
Right.
Well, you're hearing it now, and
Yeah.
if you can undo it,
So
that would be great.
I think, that needs to come from, an official channel, because it's just not how business is done with insurances and vehicles.
So let's, if I may suggest to Laquita and Edwin, let's see if we can get Sinai here for our next meeting, so we can present them with what has been said and get to the bottom of it, and present the community's concerns about the sirens being on, which I hear for every call, when sometimes it doesn't seem necessary. I think
Just
that
by
way-
the way,
Practice.
on Zoom calls, I usually mute the sirens when they come. But for the purpose of this meeting, I won't, so you can, now they turn on 108th Street recently, instead of coming all the way up Amsterdam, because they changed that trajectory, which is good for the Morningside Gardens people, but not the rest of us.
Okay,
Okay, we'll see what we can. Okay, and was that, I'm sorry,
Carol.
Carol, I'm sorry, go ahead.
I have two things. One is I wanted to just give the floor to David Vassar, because I know he's prepared some remarks on our behalf.
okay.
And the other thing is I wanted to ask if anyone got the summary of the issues that I emailed. I emailed that summary to Miriam, to Edwin, and to Dan Marks Cohen. Did anyone get it?
Yes.
Well, the ones you named, maybe that could be forwarded again.
Could that be shared with the committee? I was hoping that could be shared with the whole committee.
Wait, you received it, Miriam, Edwin?
Yeah, I'll send it right now.
Oh, great.
Okay,
Send it to
great.
the committee members.
And
Yeah.
before I just completely cede to David, I did wanted to piggyback on what Susan was saying and make sure that this committee understands that we're not just complaining about Mount Sinai. This is really a citywide issue, and all the senior care ambulances, some of them are the loudest, and there's nothing about Mount Sinai that makes it louder than the other ones, as far as I know. So we're just looking for help from this committee to launch this to a more macro approach, rather than we're not just looking to target Mount Sinai.
I have a question. Do you guys know of any other community board or neighborhood that is carrying on the same efforts that you guys are, since this is a citywide issue?
I don't know of any, but if you would like us to organize it, we certainly could.
Because yeah, that will, bring some more power, given that, CB9, but if another CB has the same problem, then you create an echo with those sirens.
And then what do you do? How do you coordinate the different CBs?
That will go through the borough president, because you will have these community boards speaking about this. Now we have to hear from the hospitals. We are in a pandemic. So this issue 2 years ago, it didn't surface up until recently again. So I think that,
Actually, the siren, the decibel level of the sirens went up. I don't know if it has anything to do with the pandemic. I don't think it does. I think this sort of has an existence of its own. So certainly the number of ambulances out there, there's nothing that we can do about that. But the issue of the decibel level of the sirens, it has increased in the past couple of years. I want to do what I said I was going to do, and I want to completely, I want to shut up and give the floor to David.
Well, hi, thanks everyone. Carol, thanks. You didn't have to quit so quickly. You're very humble, thanks. Well, yeah, I mean, I remember several years ago, Mr. Torres, we met with you and other members of the Health and Environment Committee. There were several Mount Sinai administrators there. Joseph Davis was one of them, and two others. They seemed a little bit sheepish throughout that entire meeting to me. But basically what I took away and what I have heard corroborated from the current EMS director, Robert Prianti, I don't know if he's known to any of you. I was hoping he'd be here this evening. I sent him a link to this Zoom and had told him recently that we'd be doing this. And I'll be glad to try to get him on board for the next meeting if anyone would like me to. But Robert and I had a couple conversations. He corroborated what I think Mr. Davis said a couple of years ago, and that is that Mount Sinai folks don't make the call. It really is FDNY and ultimately the state that sets the guidelines for siren use by Mount Sinai EMS personnel. So these guys are really in a bind. They know that they're creating one hell of a racket that some of us, you know, a lot of us really have a problem with. And I know some folks in the CB7 zone who I wished also could have made this meeting tonight, but couldn't quite make it, who have similar issues. So the loudness cannot be adjusted. That's another takeaway from my conversation with Mr. Prianti. And the siren is supposed to be run continuously whenever the lights are activated. Now, I have to think about this twice. It makes zero sense for that to be a requirement. I mean, late at night, especially in the dead of night, when we're all trying to get some sleep, the lights alone should suffice out there on our streets. We have far less traffic. The lights are brilliant. They're dazzling. I compare them to fireworks, which is that's another issue. Forget I said that. Yeah, and so my ask definitely is that late at night, if we can really just have the sirens muted during that critical period when we are all trying to get some much needed sleep, especially in this pandemic era, right? That is I mean, that's just a huge ask on my part. And just in general, and I wrote Richard Godfrey several years ago too, our assembly person who's head of the health committee on that level. And I didn't hear back from him, but I was really asking him if we could possibly have the rules amended so that Mount Sinai personnel could practice discretion in their use of sirens. And so that's one thing I was hoping Robert Prianti could be here tonight to discuss a bit. In any case, that's it. So the sirens themselves as a device cannot be reduced in volume, according to sources I've heard straight out of Mount Sinai. And there's no flexibility on the part of the operators as far as how they use them. Now, in fact, I have seen Mount Sinai trucks go through intersections in the evening after dark, just pulsing their sirens or maybe not even using the siren. And I have been grateful in such moments. I mean, seriously grateful for that. But they are not supposed to do that. They're supposed to run the sirens, coterminously with the lights. So, so it's an inflexible policy and it's a very inflexible device. And as far as I'm concerned, the device is defective, inherently defective, but it can't be adjusted. You can't position it on the vehicle in such a way that it I'm on the 15th floor and I've been jolted out of my sleep a number of times by sirens. So I'm beginning to sound like a rant, at least to myself, but in any case, that's where we stand. My ask is that we, give our EMS personnel the discretion to use the sirens according to their own judgment, that there's no way they should be held liable. I agree with you, Mr. Torres, for a motorist's inability or unwillingness to get out of their way when the lights have clearly warned them of the ambulance's approach. I mean, it's just, it's a no-brainer, I think. So definitely reduce usage, 0 to very little at night whatsoever. And at other times, let the operator have discretion. If pulsing the siren going through an intersection on the red light this seems like the thing to do, fine, let the driver decide. I'm gonna put a couple of readings in the chat, the links to a couple of readings, one by a veteran EMS technician who 35 years experience, who has noted that use of sirens does not improve arrival response time, and it doesn't improve patient outcomes. And I think this is a pretty definitive article, really, for one of the points I'm trying to make. And the other article is from Atlantic Magazine, talking about a sound focusing technology that's on its way, that I really hope Mount Sinai will be one of the first to adapt when it comes along, because one defect of the siren is that it is, as I've heard it, read it, put, omnidirectional. It does not discriminate in direction. You cannot focus that noise where it's most needed. Instead, all of us within a quarter-mile radius at least are subjected to it to the fullest extent. So that device, I think, just needs to be replaced, just phased out, and sooner is better. As soon as the old devices just run out of juice, I guess. And yeah, sooner is better. So I'll get those links. Hopefully you'll find them useful. Take a look at these articles. I'll put them in the chat, and please, when you have a moment, take a look at them.
Thank you, Dave,
That's
Dave,
it.
Carol, and Susan. Meanwhile, are there others on the committee or present who have comments, statements?
So I would say, you guys don't give up on this. This is how legislation has changed, right? Laws are not, are not to be changed, right? So this is the first step, and we have taken this into consideration. We have written letters. We submitted some of the medical literature to support that. The next step is you need to talk to the electeds. These electeds that you vote for. We have a new council members.
Borough president.
Borough president. So you need to go to them because they have to listen to this issue. Now, the other thing is that, we have to hear from the other party too, right? As to the feasibility of these, targeted noise devices. And, there's many different things that have to be looked into, such as, does it cause damage to that person that is being targeted, to their acoustic? I don't know if you guys heard of something called Havana syndrome. What's the liability with that? So these are a lot of intricacies, but the conversation has to take place. I think we're all very reasonable that a disturbance is taking place. And we need to find a common ground where safety is number one, and then we can see how we can pair that with a quality of life. I think
Thank you. I think you hit the nail on the head, Edwin. Thank you. I think it's obviously up to the electeds, but what I was hoping that the committee could help with is two things. One is to help us identify which agency, which electeds, or which agency exactly has the authority over this issue, so we know who to talk to. And secondly, whether the committee can help us put its weight behind our requests, so that we're not just 3 people, or we're more like 15 people that we represent, but that it actually has the gravitas of the committee.
So
Interestingly,
no, go
I
ahead.
was going to say the incoming Manhattan Borough President, Mark Levine, is formerly chair of the City Council Health Committee.
Right.
So there's a strong interest on his part, I'm sure, just from the standpoint of an health issue. Getting a good night's sleep is certainly a health benefit. But
Absolutely.
so I think that's a good start. And whoever the current, I'm not sure when committee assignments will take place with the new city council, but the health committee person would be, we have to find out who that is if we don't know now. I think it's too soon to know now, but that would be another person. And perhaps we could do virtual or try to get something going with this issue so that at least we can get some answers and, like Edwin says, get Mount Sinai involved. But I think Edwin's suggestion of it not being strictly Mount Sinai, but a citywide issue, perhaps that would be a stronger case. So starting, of course, with Manhattan Borough President and whoever's chair of the City Council Health Committee would be two good starts.
And who are the electeds that we talk to? The one that we start with the one that we vote for, because they have an interest in making sure they have to hear the constituents, right? And in this committee, we have supported this effort. We have a letter that we wrote and we signed and we sent it to the hospital. It's there. I think that the coalition, it has to now permeate to these other folks who are dealing with the same issue, but probably do not know. I see the Serenity Committee tackling many issues, not only the ambulance. Noise is a weapon. And, go to read the paper on Havana syndrome. Of course, that is extreme, but it is a weapon. So you guys have a pulse on an issue that affects the quality of life of many New Yorkers. And this could be really big in the city. Not only targeting sirens, I deal with my own noise issue. I have a bar below me that, play music. I couldn't sleep on New Year's until 5 o'clock in the morning, 5:30.
Well,
I work the next day. So, this is an issue, right? When unwanted noise causes a lot of distress. And in that letter that we sent, we put those articles that show that it raises the cortisol level. Cortisol level increases the plaques in your artery and increases the risk of you having a stroke or a heart attack. So just because it's 2 years old, it doesn't mean that it's not relevant today. So I think for the next meeting, we can have Sinai here. And maybe if the new council member can come, that will be nice too.
And perhaps our borough president as well.
Somebody else had a question?
Arlene has her hand up.
Arlene has a question. Arlene? You're muted.
I happen to do the research and write on the adverse effects of noise on health. I think David knows my research. I hope other people do as well. I have a book that I have co-authored, chapters, and the previous speaker just spoke about noise in general as having an adverse effect. So you can have my research, my papers. I serve on Grow NYC. I chair the noise committee. If you go to that website, you could hear my podcasts and look at the literature. But let me add something else. We do have solutions. We have heard that other cities in Europe use a different quality of siren, and we should look into that. So one of the things I'd like to suggest, stress the health impacts. Yes, loss of sleep can lead to serious adverse health effects. But the other thing is data. If indeed there are data to suggest that you could change the sound in a way that would be less offensive, that should be looked into. Number two, if you're going to suggest ways that they may be able to alter what they're doing, think in terms of a pilot study. Now, it is ironic that a hospital that cares about people being ill should not worry about preventing illness. You know, you should do no harm when you're trying to help people. So if this committee would want my assistance, my research is all available to you. Just type in Grow NYC, go to the noise section, or type my name into Google. But I do think we should explore seeking out cities that may use types of sirens that are less offensive and see if indeed there are data. And as a college professor, I have to apologize for that. I do care about data and research, and I think we should present this in a way that demonstrates that there may be alternatives to what is being done, recognizing that ambulances must get to the people who are ill. And secondly, to stress that it's ironic that a hospital would be using an instrument that may impede the health of people in this city. So in any way, I would definitely help you and work with you. And Dave and I know each other for a long time. Good luck on this one.
Thank you, Darlene. Thank you.
Can you
So-
put your information in the chat, your contact information in the chat? Is that possible?
Okay,
Thank
I
you.
will try. And
All
I will
right.
try. It's Grow NYC. You're
Okay,
familiar
Grow
with
NYC. Got it.
The green
Okay, I think
market,
I've seen
the
that.
farmers markets.
Yes,
Okay.
Yes.
I'll try.
got it.
Okay, thank you again. Victor, do you see any other hands in the chat, or is there
No.
anyone else who wants to make a comment?
No, I think we could move on to your next piece.
Okay. Oh my goodness, I don't have the agenda in front of me. What's next?
You had someone in the chat that was trying to present. Are they still there?
Kiefer Braithwaite, but I thought that, okay, I thought there was something
don't-
else on the agenda too. Okay, Kiefer Braithwaite.
I don't see him. I don't see him.
Kamba or Kifa, am I pronouncing it?
Oh, yes, Kifa. You
Oh,
pronounce it.
Kifa, okay. So, you have the floor. You wanted to, the opportunity to, speak briefly about, your organization.
Yes, thank you. My name is Kifa Brathwaite. I work for an organization called the Ladies of Hope Ministries, and I manage the Angel Food Delivery Project. Can everyone hear me okay?
Yes, I
Yeah.
can.
Okay, so
What's
we
the organization? I'm sorry, I'm just taking the minutes.
Kifa, K-I-F-F-A.
Yes, my name is
Brathwaite.
Kifa. Yes, I am representing the Ladies of Hope Ministries. I am the program manager for a project entitled the Angel Food Project.
Oh,
And
great.
we are a grant recipient for this year. And we will be reporting on the work that we have done within the district on the 18th. And it is a requirement to attend one of the committee meetings. And I selected this one just because I thought it would be the most in line with our mission and the work that we do. But
Thank you.
yeah, and let me just say, I really enjoyed sitting in on this meeting. So thank you again for letting me join. And if it's okay, I don't know if I'm able to share my screen. I have a really, really quick presentation. I promise you it's so quick. It's about 3 slides. I'm not sure if I have the permission to share my screen.
Victor, is that?
I don't have that capability. Hold on one second. Let me
It's
see.
okay. I don't have to share it, but
Okay.
I just had like a few pictures and things that I wanted to show, but I mean, it's okay. I don't have to share it. If you will allow me just 1 second, I'll go through it. So, like I said, our organization is the Ladies of Hope Ministries, and we were founded by Topeka K. Sam in 2017. Topeka K. Sam was incarcerated and released from incarceration in 2015. And at that time, she was unable to find a job until she was introduced to Instacart. And through that introduction and through that job with Instacart, she was able to make some connections to other women who have also recently been released from prison and were in need of simple services like food, housing, and she started making connections. And through that, birthed the Angel Food Project, which today we're serving, just rounding off this year, we had about close to 3,000 bags that we were able to deliver or connect to individuals around the city. We are working in all 5 boroughs. We also obviously do work in Harlem, which is where our office's headquarters is located. We do have an office at the Harlem We Work on 126th Street. So a lot of the work that we do is in Harlem, and very excited to be able to work in CD9, Manhattan Community District 9. I myself live in Queens. I just recently moved here from Brooklyn, where I was born, but I was always kind of dedicated to that work on alleviating food insecurity in New York City. I come to the Ladies of Hope Ministries from working at the New York Common Pantry, which is also located in Harlem. I worked there for about 3.5 years. I'm trying to go quickly, but one of the questions on the recording asks about who benefits from our program. And so the delivery, I'm just gonna read. The Angel Food Delivery Project eliminates the need to wait in long lines, typically seen at traditional food pantries, as we utilize dedicated food pickup times and home delivery options. We promote dignity and reduce food waste. Since 2015, like I mentioned earlier, we have connected with over 5,000 households across the 5 boroughs, and we've connected individuals with free, healthy, high quality foods that saves, thousands of pounds of food from being sent to landfills. It also provides our program participants with a little more leeway and what they can do with their money, as understanding they don't no longer have to spend that money on food. They can spend it on other things that they need. So this program, we prioritize women and families that have been impacted by incarceration and the criminal legal system, which unfortunately, if you live in New York City, you've probably been impacted by the criminal legal system in some way, shape, or form. We, however, do not discriminate based on race, color, religion, gender, age, nationality, disability, marital status, etc. But we do prioritize women and families. Excuse me. So our program provides healthy food options that can have positive effects on physical and mental well-being. I'm pretty sure that you all know about some of the health disparities that many of us face, many people who are living in quote unquote low income communities. I like to call them marginalized communities, but healthy food can have positive effects on that. And a reliable food source, like I said earlier, can allow families to use more of their income to meet other basic needs, such as housing, healthcare, and education. So just to stare into a little bit of what we've been able to accomplish in 2021, we have so far been able to serve 488 New York City households. That's across the 5 boroughs. And within CD9, we have connected 91 households in 2021. And we have completed 52 home deliveries. So we were able to deliver about 675 bags of food within the district, community district 9, excuse me. Another question that was asked in the reporting requirements was how can we know for sure that residents are in community district 9? So we do ask our program participants to fill out a registration form. And within that form, we do ask for some personal information, including name, address, phone number, income range, and the information for other household members that they may have. So if there's children in the home, if there's allergies that we should be aware of, or dietary restrictions that we should be aware of, we ask for this information as well. Excuse me. So we also utilize software called Salesforce, as well as Google Maps to help us just map out where our participants are, where we want to recruit, and where we see the most need, and where exactly we need to be. Excuse me. Sorry, it's very cold in my apartment. The heat went out yesterday, so I'm very cold and I'm like shivering. So I do apologize. I do apologize a little bit. So also on top of our regular registration form, we do some what we call recruitment events. And recently, starting November this past year, 2021, we've started recruiting directly into apartment buildings, excuse me. And so far we've completed 3 apartment delivery days. So we go into a building and we would deliver to every apartment within that building. And we have successfully completed 3 buildings. One of those buildings are in Manhattan Community District 9. We're able to service 90 Convent Avenue, which is Convent Avenue and I believe 132nd Street. I believe in 2 weeks, we will be doing 1683 Amsterdam, which is on 143rd Street and Amsterdam Avenue. So yeah, when we were doing other recruitment events, we realized that not everybody that we were able to recruit from those events were in districts or in the community that we were recruiting in. So we decided to just go ahead and service buildings or apartment buildings. So 90 Convent Avenue came to us through a request. So we were able to connect with the building management, and a week before we actually came into the building, we were able to just let the residents know that we were going to be coming with food on a certain day. And right now I am the only one managing the program. I'm the only one working in the program. So I rely heavily on volunteers. So it just gives me time to recruit volunteers who are able to come with me on these days that we do these deliveries and help out. I did have some pictures from what we were able to do, but I can share that with, I'm not sure who, if you wanted to see some pictures. But we also partner with other organizations to continue to bring services to our participants. So we partner most recently with an organization called Harlem Park to Park. Oh, are you familiar? So we had our first partnership with Harlem Restaurant Week, which I'm not sure if you are all aware of Harlem Restaurant Week. That happened in November, but we were able to partner with them to provide Harlem residents with food. They were able to choose what they got and able to choose the restaurant that they received food from. And we had about 56 restaurants, all Harlem-based restaurants that were able to donate meals to our Harlem residents. And we delivered, we picked up the food and delivered to their home. And it was a very great experience. Again, I have a lot of pictures from that, but we were able to serve 38 different households, and 17 of those households are in your District 9. So I was very happy about that. And, we do have a few other partnerships in the works right now. Again, we do work across all 5 boroughs. So we're not always able to completely dedicate all of my time to this particular district, but I'm very happy at the work we were able to do in the district. And actually, I'm very proud.
Kifa,
Yes.
do you mind? Someone has asked. Oh, someone has asked you to repeat the name of your organization
Oh,
again.
yes.
Give that information.
Yeah, sure. My organization is called the Ladies of Hope Ministries. We do have a website. I can add it to the chat if you would like to see our website.
Yes.
LHM.org. Also, this project is called the Angel Food Project. I'll put that on the chat as well. And we have some social media. If anyone would like to see, I can put our tag there. If anyone wants to see our social media, we have Instagram, Facebook, and Snapchat. Don't quote me on the Snapchat, I'm not sure. But I know for sure we have Facebook and Instagram. So if you are interested in finding out a little bit more information, you can, of course, visit our website or follow us on Instagram. I can always also put my email address there. If you have anyone that may be interested in joining the program, you can, of course, have them email me directly. Yep, that's it. I don't know. I didn't want to waste all of your time. I know I wasn't on the agenda, but if there's any questions that I can answer, definitely ask. I don't know.
Thank you for requesting to make a brief presentation. And it would be great to see the pictures and have other information. Are there questions?
I have a
Keith?
question, if I may. In terms of housing for previously incarcerated women, do you provide that as well?
Yes, we do. We have a Hope House in the Bronx. Right now, we also have a Hope House in New Orleans, Louisiana. We're in the works of opening another one in Miami, but we do offer housing opportunities for women who have recently been released from prison or have been impacted by incarceration or the criminal legal system. So that would include foster care as well.
Okay. I'd like to refer you, someone from Living Hope Redemption Church.
Oh, yeah.
They're dealing with people, Reverend Windley, dealing with women coming out of incarceration from the area, Manhattanville and Grant houses in particular. And I know that's been an issue from time to time. So maybe I'll connect with you on that.
Yeah, sure, no problem. I'm always available.
Great, thank you.
I can also put my phone number here if that's easier. I'll put it right here in the chat.
Yes, that would be great.
Yeah, I just have a comment. I think
it's
go ahead.
Karma or Kifa?
It's Kifa. My name is Kifa. I'm sorry. I'm not using my computer. So I'll put my name right here in the chat. I do apologize.
Okay.
Breathway.
Yes. Yes.
Okay, Edwin, you had something to ask?
I think you guys are doing a great job, and thank you for taking on this cause. Food insecurity is huge.
Yeah.
And I'm not gonna say all the things that we already know, but to keep folks' dignity is huge.
Yeah.
Many people do not like to seek services because of the stigma attached to it. And for them to stand on the line, that sort of takes, for some folks, they feel it takes part of the humanization. So bringing that humanity back is priceless to many people.
Yeah.
Mm-hmm.
Yes. I didn't. I'm sorry. Go ahead, Laquita. Did you have something?
No, you go ahead, and then I'll respond after.
I just wanted to say that I didn't include it before, but we do have a partnership with a company called Expensify that we're able to reimburse people for being a part of this program. So we offer our delivery in two ways. We either do a home delivery or we would send someone to a local supermarket to pick up food. They don't have to wait in line. They just go, they say their name, and they would get a package or a grocery package, and that grocery package could sometimes look like paper towel, toilet paper, basically anything you can get from a supermarket. We don't have anyone in Manhattan Community District 9 enrolled in that program currently. I am looking for more people to be a part of that program, but whenever we do have someone pick up from a supermarket, we're able to reimburse them between $7 to $15 each time they pick up. And we have some participants who get like, you know, $200 a week just because they're constantly picking up. So that's just another thing that we're able to offer. We're expanding that program. That partnership has only been available to us since October 15th. So we are expanding right now that program.
Now, the grant that you received, is that for this coming year, or that was for the past year, past fiscal year, when you
Right,
referenced the grant?
Right, that grant
Yeah.
period was from July 2001 until June 2021. No, 2021 until June 2022, excuse me.
Oh, you're in the grant year.
Yeah, so we're within the grant year. But I will say that we didn't actually get the grant until October. So we did have a few months where, you know, we were kind of in limbo.
Right, you mentioned that there are 675 bags that were distributed in District 9.
Yes.
Wow. Now, is that one time, or those were represented repeats? About how many people did that
So
represent?
actually, let me get the actual number. I believe it was 91. But typically, what we do see with people who are experiencing food insecurity is that they need the help on more than one occasion. So we typically tell people that they can expect to receive food from us at least once a month. And most people receive, you know, more often than that. But just because we are a smaller growing organization, I try not to exceed anyone's expectations. So I tell people once a month that they'll be able to receive food from us. And typically that food would look like enough food, depending on the household, enough food to last about 3 weeks. But
now, okay. Now, of those 91 persons, that's just who you are able to find? You think the pool is larger in District 9 of those are all formerly incarcerated?
No, so we prioritize women who have been either formerly incarcerated or impacted by the criminal legal system. We don't discriminate, so we accept anybody into the program, anybody that has a home or has an address that they can use, or has the availability to cook the food. The food that we do give is uncooked food, so we unfortunately at this time do not service homeless individuals, as they need to have a place to cook the food. So yeah, that's our only.
How many more, with your current financing, approximately how many more people do you think you could serve this fiscal year?
Well, this fiscal year, I'm hoping to get at least within the district about 200. I say that because we don't actually provide the food. This is through partnerships with other restaurants and pantries and supermarkets that we collect the food and then distribute it. So we don't really have a cap on how much food we can give because we have so many partnerships. So for the rest of the year, my goal within the district is 200. Yeah, and we're on track to reach that goal.
So the hunger situation is pretty bleak, or grave, you would say, in our district.
Yeah, and I mean, this problem is across all 5 boroughs, across the country even. But you know, Harlem and the Bronx have been hit hard with some of these numbers. And although I do live in Queens and I'm from Brooklyn, you know, New York City is still in my heart. And you know, whatever we have to do to get the ball moving, we have to do.
You're doing great work. Any other comments or questions? Let me
Could I
see what's
just-
in the chat.
Could I throw out a question? Yeah,
Okay.
Kifa, not Car, Kifa, yeah, thanks for all your great work. I'm
Uh-huh.
wondering if you partner at all with, well, for one, the Fortune Society comes to mind. I wonder if they're aware of your work and your organization. I'm superficially kind of acquainted with them just from having met at that in their
Base.
in their building. And I'm also, I think of City Harvest and Food Bank, which are also doing great work. I'm always sometimes wondering, there are a number of organizations doing this great work, how word gets out to community members, and now, who needs the funding the most? I don't know. I mean, City Harvest, I think, has been around a long time. They're well established, and I generally, like to contribute to them. But what your group is doing too is great. So
Yeah,
yeah, just wondering.
that's actually a great question, David. So thank you for asking. But we do work in a very small capacity with City Harvest. We're not a pantry or a soup kitchen,
Right.
which City Harvest does prioritize pantries and soup kitchens, and we are not that.
Okay.
So we're not always able to get the food from City Harvest just for that reason.
Okay.
But we do partner with pantries. I used to myself work for the New York Common Pantry, which is one of the largest choice pantries in New York City. And they get a lot of their food from City Harvest and from food banks. So what we are is we're not a food pantry.
Right.
We do not harvest or store food. So
Okay.
I don't know if that answers your question.
Yeah, just curious if there were, connections there. Yeah. Okay.
Yeah,
Thank
so
you.
there are connections there, but not directly.
Right. Okay. Thanks.
Very important information. Thank you so much. And we have your contact information.
Yeah.
And if there's any additional information that you would like to get to us, make sure that you can, you reach out to us the way you have today. And if there's another session you would want to for any updates, please let us know. But we'll be in contact with you as well.
Yeah, and
Can we ever do referrals?
I'm sorry?
Edwin?
Can we do referrals if there is someone in need in the community? Can we
Yes,
send
of
them
course.
to
I
you
was
guys?
just about to say that. If there's anybody, or any of you or anybody that family members, if you want us to come to your building and distribute in your building, let us know. I will do all the work. I'll reach out to building management. I will do everything. If you just email me, I'm always available. You can contact me in my email, my phone number, the Instagram, our website has like a contact part that does come directly to me. So I'm always available. I'm always looking for more people who are in need or people that I can help, within the New York City area. We are branching out into Westchester as well. So if you know anyone in the Westchester area that may be in need, we are very, very small amount, we're like trying to expand in Westchester, but we are getting into the Westchester community, Yonkers, particularly Yonkers, and into Long Island, particularly the Hempstead area of Long Island. So if you have anybody within the 5 boroughs, Nassau County or Westchester, we are moving into Newark, New Jersey as well. If you have anyone that's in need, or not even in need, like anyone who would appreciate the assistance, please, do not hesitate to reach out to me. I'm always available.
Well, we
Awesome.
appreciate this.
Thank you so much.
So, yes. This has been
So Miriam, Laquita, I'm sorry, you have 2 more items on.
I thought
agenda.
that was it. Okay,
No,
okay.
You have forums that you might want to do for this year, and then the task force for cannabis are listed on the agenda.
Okay, so maybe let's
Forum.
try to spend no more than 15 minutes
Okay.
on those next 2. the community board, our committee forums for this fiscal year. As you may know, each of the committees have a grant of $1,000 to put on a forum. And last year, it's not always 1,000, but anyway, last year's forums got extended so that we could make up for what we didn't do last year during this fiscal year. In addition, there will be an opportunity for this fiscal year's forum. So essentially, we can do 2 committee forums, community-wide forums. Do you have suggestions, or do you need more time to think about it? Send me an email, or email the committee with your ideas, and each of us can respond. Or do you have some thoughts on that tonight in terms of a community-wide forum? And we have the opportunity for 2 because the money is there from last year's. It's $1,000. And then I'm just going to assume it will probably be $1,000 to put on one for this fiscal year. So 2 possibilities. Was that Edwin's voice I heard?
Yeah, I was gonna bring it up to the Serenity group, since they have been coming to us for years now. If they had a proposal for something regarding noise pollution in our community. But they have signed off. Yeah, if they,
yeah, I think it's just the committee here now.
It's just us.
But that's an idea, so we can put that down, the Serenity
because
possibility for a forum.
Indeed, when we look at this issue with noise, a lot of folks of color, they are affected by it. Now, do they know their rights when it comes to that, and who to complain and how to go about it? I'm not so sure. But we have other issues. But if you look at the complaints that we have in CB9, noise is right at the top.
And we haven't done very much in terms of environmental.
Yeah, it's an environmental and a health.
That would be good for this.
It marriage both as who was Arlene, the professor.
Darlene.
She was
with the book, the writer
with the book and all her research. It is also a health problem.
Absolutely.
And noise affects people. So that is our number. If you look at the complaint that happens in our CB9, that is right at the top.
What about the rest of the committee? What do you think? Let's see who's here.
We have Monica, Heather,
Victor, Solomon.
I'm still here.
What do you think about community forum? Edwin has put forth the noise issue with the Serenity Committee, and maybe having them do the outline and footwork on that, since they've kind of offered it in another way this evening. That could be good. We have the capacity for 2.
Yeah, I think Edwin's proposal is great. I think it would definitely meet, like he says, meets kind of both the health and the environmental concerns that people in our community have. So I think if we could create a forum, either helping the Serenity group or having them outline what they would like to see done, I think that's a great idea.
Right. It would be the community board's committee forum, but with their being the there being the muscle behind it in terms of we would all have to work on making sure it's attended, it's promoted, so that people know the benefits and will attend.
Correct. Yeah.
Mm-hmm.
And we already have some experts in the community that can help us with the aspect of environmental pollution from noise, and also the health aspect of it.
It
So if
sounds good to me.
if we start
Um,
early, I mean, I know when we do this proposal, we have to do a need assessment. Is right up there with these 311 calls from the whole CB9.
Okay, and I have a format that we can work with. The main thing would be timing. With COVID and meeting, it probably would have to be something in maybe in the spring, but maybe March, maybe March could work. But okay, what about another compelling idea, second one, since we have the opportunity to put on two? Have we heard something, or do we want to wait on that second possibility to see what else unfolds? We've tackled a lot of issues in committee.
I'll bring another. I think the education behind the overdose prevention centers.
Oh, that could
I
really
think
be.
a lot of folks in our community, they have a misconception as to what this is. I think as a committee, we will have to, see, but we have a lot of these treatment centers, not a facility like this, but we have some centers that house.
There are treatment and addiction centers, and some are mental health facilities that are dealing with people who have mental issues because they have been addicted, or vice versa. They're addicted and then have mental health issues. And it always creates that not in my backyard.
Yeah. And we had a great presentation today. I think that Dr.
Michael
McGray, he was phenomenal. I think we can get other people, and that could be something else. I don't know what everyone else think.
I like that, especially if we deal with the hard issue of why it troubles some of our neighbors.
Yeah,
it has that component in there as well.
And it can help folks also understand how to hold these institutions accountable. Like if you see that some of these institutions are not doing what they're supposed to do, who can you contact? So then they can come back to these private entities and say, look, you have a responsibility to this community. And folks have complained that you guys are not doing your job. You cutting corners. In that forum, I think it can apply also to the treatment centers that we have, methadone, clinics that we have around.
Exactly. What do the others feel about that? Again, Victor, Monica, Heather, I believe is still on. Solomon, Heather.
I think that's a good idea. We need to
That
have
was
another
Monica.
voice.
Yeah.
We need to have another voice other than the Greater Harlem Coalition.
Exactly. Okay. I like both of these community forum ideas, and we have, if that's what we've decided on, and 6 of us are here, there might be one that we have 2 people on lead. Well, actually Edwin's on lead too, but he's here. We have a couple of people on lead, but I think if we decide on those tonight as our interest, that gives us a nice bit of planning time. Edwin, you were going to add something. I'm sorry.
Yeah, I was going to say that, I'll come back from my leave. I just have to finish that last chapter that I have. But this is, to me, this is fun. All the conversation we had today is just.
It's up your alley.
It's up my alley, yes. So I will contribute as much as I can.
Okay, so now the next thing, if we can move forward, let's see, let me check the chat. Let's see. I think we covered everybody in chat. So the next thing is, oh, what was it, Victor? Is it the community forum? And then, oh, the cannabis task force. Is there someone in the group that wants to be part of that? Since apparently it was decided on several months ago, I think. But I don't know that any persons were recruited. And of course, people can be recruited across the community board. It's an economic concern of economic impact, that is, as well as our committee health concern, and then education again.
I had
so
suggested it in my strategic planning committee meeting. And
think
I
that,
I suggested it be across health, economic development, and I think important also would be education, as you suggested. Miriam had stepped forward before. You run it by her just as a courtesy, so she's not here. She might be wanting to take the lead on that. It's up to you guys. I'm just making, just trying to put it out there. And I spoke to Joyce and Merida Dunn. They were going to get back to me with a person to help start
Joyce
that.
Adewumi?
Yes.
Uh-huh.
Joyce Adewumi, correct.
Oh, is Joyce Education Committee now?
No, economic development.
Oh, she's okay.
Yeah,
okay.
her and Merida.
Oh, she and Merida. Okay.
Right.
Okay.
I had mentioned it to education, but we can do that.
Okay. Asking Miriam to, if she's interested in heading it up, would be terrific. She's done a lot of work, and she attended some citywide meetings that were held at the mayor's office, or under the auspices of the mayor's office. So that's fine with me.
I think it'll fall nice into the strategic committee and having the 3 committees worked on, because as far as health, we, wrote the letter, we push it forward. But now it's going to take an equity part, right? And that comes from the economic committee.
Right.
So I think that makes a lot of sense for us to sort of, work with the other teams.
Thanks, Victor, for your, recommendation and foresight with that as well. So that sounds good. Should the health committee be the ones to ask Marion, or should that come out of your area, Victor, from strategic?
No, it should. You guys should, put forth someone. I don't want to make that decision. I just mentioned her name because she had brought it up before. And she had to leave for another meeting, she put in the chat. So I just want to make sure that it was fair to all, no one else stepped forward. So you can reach out to her and, see if she's interested.
So we said health,
economic development and education.
And education. Okay.
I don't know, with housing and with, I don't know, does that stop?
No, I think those 3 are good. You might stretch it too far if we go with housing. I just think those 3 are kind of solid right there.
Okay.
Anybody else on the committee have input on that? Heather, Monica, Solomon? As far as a task force for cannabis, which committees would be most appropriate to deal with that?
I think you're on point.
Economic development, that's it.
Okay.
That's the most important.
Okay, Heather, you were saying?
No, I agree. I think you're on point.
Okay. All right. Thank you.
Okay. All right. And with that, this has been a good meeting. Thank you, guys. You've been terrific. And I'll get with Edwin, or you'll email me your notes, Edwin.
Yeah,
and we'll stay I don't want to take you away from what you have to do, but with your studies. But just email me and we can get the minutes ready. I guess I'll have to be at the executive committee meeting, huh, Victor?
Yes, so.
No, I left you would just have to look at very minimal, the recording. The only part that I missed was where Arlene was with her speech, because I paid more attention to her than taking notes. Very minimal stuff. And
Yeah, I
I
took notes
and I
on what she-
highlighted that for you.
Yeah, and I took notes on hers because what she said was really on point as well.
Yeah.
Okay, so
I
Ken,
think there's a way to do live transcript. Is that correct, Victor?
I have to ask Uther. I think there is.
Right.
ooh,
and-
there should be in this modern
No.
age of technology.
Right.
Think-
No,
think you're right.
it says live transcript there, so that way you
Oh,
would
right,
have to
right,
do
right.
it,
Oh,
right?
wow.
Yeah, you
So I
can, you can,
You can do
you can
that?
click on live transcript and then you can view it.
Oh.
Typically what you would have to do is then, copy and paste the,
Oh,
you know,
gotcha.
the text.
Right, because what I
Oh,
see,
that
it
is
says live,
fabulous.
Wow.
it says here, live transcript has been enabled.
Wow.
Has
Oh.
not been.
Has been.
It
has
is.
been.
Oh, okay. Yeah, because I'm getting something across the screen. So if it
Yeah.
can do that, the main thing is, of course, sometimes the wrong word is used, or
Yeah, that's okay. You can go over
that we can
but-
correct that.
Right, right. I think it's enabled. I don't know how to print it out though.
Let me look at more. Let's see something.
So if you hit live transcript, you go to view, and then you can save it. It'll save it as a text document on your device.
Oh,
Thank
okay.
And it
you.
has to be done right
Thank you.
after the meeting.
All right, so shall we move
Yes,
to
you should.
adjourn the meeting?
You should do it. You should do it at the end of the meeting. Correct.
Gotcha.
Yeah, don't. Oh, fantastic,
Yeah,
guys.
do it before you close the meeting. Is what I should say.
All right.
Well, you know what? You can do it right now.
So shall we move to adjourn? Any second?
Yes. Any motion to adjourn?
I have a question for Solomon before you.
Yes.
I saved it, and now how do I send it to myself?
Ah,
Okay, so what on your computer? I'm assuming you're on a computer.
Yes.
It will save the transcript in the Zoom folder. There's a program files folder for Zoom.
So,
If you're on a Windows machine.
oh yeah, here it says, yep. Let me put it.
And then the save transcript should be there.
Alrighty.
and it's a good thing that you mentioned it just then. Thanks, Monica, and then Victor, because so if we had closed out the meeting, and Victor was still on, could he have saved it, or with everybody closing, would that have shut out all the transcribing?
So because you right now, you and Victor are the hosts of the meeting. If both of the hosts leave, the meeting is finished. The transcript, you have to save the transcript before the end of the meeting.
Otherwise, it's just gone forever.
It's just gone, correct, yeah.
Oh, okay. Okay, very good. Thank you, Solomon.
No problem.
No.
All right.
Okay, so who moved? Was it Edwin who moved to adjourn, and who second?
I'll second the motion.
Solomon? Okay, thank you, guys. Thank you so much. Okay.
All right, bye-bye.
Good night.
Have a good one.
Okay.
All right,
You
good night.
too.
Bye, everybody.
Bye.
Thanks again,
Okay,
Solomon.
Victor, let
Appreciate
me-
it.
Yes, no problem.
Yeah, Victor, let me know in terms of the transcribing, then I'll take what Edwin has and then be able to compare, because it's gonna have to be shortened, of course, because it's so long. It'll be 2 hours.
No, it'll be
2.5
much
hours.
easier because
It'll be
I have
easier, but it's 2 hours.
I have
worth of
11
reading.
pages, but what I did, I took this. Let me show you guys real quick what I did.
Mhm.
This is what I did. Gosh, let me just put this at 100. So I just put the you just go over the first, so you can see the visitors that we have and put their names. But I took the first.
Oh, you
person-
got some of the slide presentation. You got those too.
So I put each graph with whatever they were saying, just in case, because sometimes the presenters they'll send us like a modified slide.
Right.
And then I put the question that follow up there, and I put the response with the person. So I put, so I'll fix it for you.
All right.
That'd be great. And you know something, this, when we can show the presentations, the graphs and all, it makes for, even for posterity, some good minutes, good looking minutes, you know, cleaned up.
Yeah,
And just with the graphs, it's a good record
yeah,
of all the
absolutely.
work.
Yeah.
Wow. Okay, so
Right.
we have to
Thank
remember
you,
that.
Laquita. And thank you,
Thank
Victor.
you, Edwin
Okay.
and Victor. You
All right.
are wonderful.
Thank
Thank
you.
you so
Yes,
much.
thank you.
Thank you
Have a good
both.
one.
Thank
Take
you
care.
Okay,
both.
all
Take care
right.
now.
Bye-bye.
So I'll get the emails from both of you.
Yes, I'll send
look
it to you.
up. Okay, great. Have a great evening.
You too.
Okay. Bye-bye.
Okay.
Let's see, leave.